Welcome to Shruti Outloud, a podcast where I invite guests from different walks of life to share their stories of following their passion, success, and happiness, which in turn motivates our listeners to follow their heart. Hello, and welcome back to Shruti Outloud podcast. This episode is another collaboration with Queen's Lounge by Akanshi Garg. And our today's guest is somebody who is going to talk about a topic that has never been discussed with our audience before, that has never been brought on this channel before. And I am quite looking forward to having this interaction. So, our today's guest is Dr. Nupur Garg. She is an IVF and fertility specialist, and she's also gynecologist and obstetrician who's presently in charge of SCI IVF Center, Noida. So let's bring her on board and ask some really burning questions. And I'm pretty sure that these are the questions that even you have in your mind. So let's have her on board and let's ask all these questions from her and have her answer them. Thank you. Welcome, Dr.
Thank
Nupur.
you.
Welcome to Shruti Outloud podcast.
Thank you so much, Shruti. It's my pleasure.
We are glad that you have accepted and agreed to be a part of this and sharing your knowledge with all our audience. And I think this is one of the topics that is not discussed very often. And also, a lot of people don't really know about this. So let's get into the list of our questions and take this conversation ahead. So, my first question for you would be, could you tell what is IVF for a better understanding of our audience?
So, Shruti, IVF, if we expand the full form of IVF, it is in vitro fertilization. And fertilization is if you explain it in a layman's term, it is the meeting of gametes, male and female gametes. And in vitro means lab. So, in IVF, that is in vitro fertilization, what we do is we extract the eggs from a woman's body and then we fertilize it with a male gamete, that is sperm, in our lab, and the baby which is normally formed in a woman's body is formed in the lab. That baby, we call it as embryo, and that embryo is then transferred back inside a woman's body. So this is the in a general the meaning of in vitro fertilization. So this is an advanced technique, especially designed for infertile couples or women who are unable to conceive naturally. So this is the process of IVF.
Right. Here I have a question just out of my curiosity. How much time does it take? As in, when we are talking about the embryo which is being developed in the lab. So, what is the duration of that?
If we talk about from a patient's perspective, that how long will it take for them to get their baby formed, or so it usually the process starts when a woman gets her period. So it starts from the second day of her period. In a normal woman also, if a woman is not going for an IVF, if we just talk about a woman who is planning for a pregnancy, so how we actually calculate when the baby is going to be formed in her body. So the same process takes place in IVF also. It actually is clear reflection of what actually happens normally also in a woman's body. So if we see a normal pattern in normal physiology of woman's body, from a second day of a period, when she gets a period, the eggs that time are very very small, very very tiny structures in her ovary. And as the day progresses, due to under the influence of some hormones, these eggs slowly and gradually they begin to grow. And by approximately 12th to 14th day of her period, the ovulation takes place. And once this ovulation takes place, it waits in a female tube or a female body for the sperm to fertilize with it. So it waits for the sperm comes in the body, it fertilizes with the egg. And the first zygote, that we call the fertilization product, that is formed inside a female fallopian tube. So that then further multiplies, and actually after 5 to 6 days it forms a mature embryo called blastocyst, and that time it is ready to come in, enter from a fallopian tube inside the uterus and implant inside the uterus. So the same process takes place in IVF also. Once the woman gets her period, from the second day onwards, the egg begins to grow under the stimulation that we give her. The eggs, they grow, and when they are ready to ovulate, the ovulation which was supposed to be happening naturally, that we collect the egg at that particular time. We collect the egg from a woman's body, and then we fertilize it in outside in the lab. And when the baby is formed, that same process, after fertilization, that zygote, then it further multiplies and forms an egg. So approximately, if you take it from 14th plus 5 days, approximately 19th to 20th day, the embryo is transferred back inside a woman's body. And after that we wait for implantation to take place. And approximately after transferring the embryo, after 10 days, that 28-day cycle, we get the expected result, whether the pregnancy happens or not. So the whole process of embryo formation, if you consider, it takes approximately 19 to 20 days. And if you combine it with the result, that pregnancy result, another 10 days, so approximately 28 to 30 days.
All right. Thank you for answering that for better understanding of myself and our audience as well. Moving on to our next question, what are some of the treatment options that you offer?
So we at SCI IVF Center are offering a multitude of treatments for the patient who are suffering from infertility, who are facing the problem of difficulty conceiving. So it starts from the very basic level. When a patient first consult us, we usually advise, the important thing here is to, every patient is different, every patient's requirement is different, their age groups are different. So we first investigate the patient completely. So there are plethora of tests that a patient has to undergo, both male and female partner. And once the investigations are there, based on their investigation reports, we counsel them. Counseling is done, and based on the reports, we decide what treatment will be best for the patient. So there are different treatment options available for the patient. It can be anything as simple as ovulation induction, where we just give some medications, tablets, to induce ovulation in a woman. And we ask them to have a normal course of process like they normally do. And there are other methods like ovarian stimulation. Then moving on, if the patient has failure with such treatment, then we move on towards the higher end, like we move offer them intrauterine insemination as well. And above that, more advanced like IVF and ICSI are there. It is all dependent on what the patient's criteria is, what is the patient's requirement, what are their actual basic problem. If there is a problem with the semen quality or the semen parameters, then we give them, treat them accordingly. We correct the hormonal imbalances through medications and treatment. If usually when the treatment is not, the problem is not amenable to the normal treatment, then we move ahead to the higher options. So we have all sorts of treatment, starting from normal natural conception to IUI, IVF. We also offer treatments like pre-implantation genetic testing for patients who have history of recurrent abortions or recurrent pregnancy loss owing to genetic abnormalities in the baby. And we also do advanced techniques like testicular sperm extraction in patients who have nil sperm in their semen. So such patients who have, in spite of all the medications, they have no sperm in their semen, such patients are offered treatment of advanced treatments like TISA.
Right. So, this brings me to my next question. What are some of the reasons that couples have to opt for IVF?
So Shruti, if you see nowadays, IVF, the infertility problem has become very, very common. Almost like 40 to 50% of couples are suffering from this problem, owing to so many changes that have taken place in the environment, a lot of toxins in the pollution, and delaying of fertility due to career and all these things. So the thing here is, now when we usually see the patients, the most common reason that we find people actually coming for is tubal blockage. Tubes are blocked, due to some infections in the past, like tuberculosis or any other infections leading to tubal blockage. Then there are other reasons, like patients have poor quality eggs owing to advanced age. Earlier, when the if you see a decade back, or even 2 decades back, the age for marriage for most of the women used to be in their 20s. Now it has shifted to early 30s and mid 30s. So it is impacting their fertility. The ovarian quality and the egg quality and the ovarian egg count is going down with the increasing age because of the postponement of the parenthood. So this has become a very, very important cause of infertility. And when they actually start to try, and they are unable to conceive, then after many trials, then they have to opt for IVF. Then other causes for IVF have been like male factor infertility. It is very, very common to see that sperm quality has deteriorated over the period of time, because we see lot of cases which have poor sperm quality, or absent sperms in the semen. Such patients, we usually IVF, and more advanced form of IVF, that is ICSI, is advised in such patients. Then there are other reasons, like severe cases of endometriosis. And there are also some patients of unknown reason, where in spite of trying all the treatment options, they have not been able to conceive. So these are some of the patients that usually opt for IVF.
Here, I would like to ask you one other question. As you just mentioned that uh, parenthood, when it comes to girls or women, that has shifted, and it has now shifted more towards the either early 30s or mid 30s. So, would you say or would you suggest that like birthing early is a better option, or is there a way that women can learn how to
Okay.
cope up with
Yeah,
this?
it's an excellent question. It's a very, very good question. I think it fits in the current scenario very well. You know, now this postponement of parenthood has become a reality. If, you cannot force anybody to have early marriage or early pregnancy if they are not in that state, or there it is somebody's own right and personal choice. But there are ways, every if they are planning for postponement of their marriage, or they are thinking of late parenthood, there are ways that they can decide and make a choice themselves, whether they should, if they are getting married late, when to actually start for planning pregnancy. Should it be immediately, or they can still wait for another 2 3 years to start planning for pregnancy. So there are tests, there are certain blood tests, and there are ultrasounds which can predict their fertility. Okay, so every woman is different. You should never copy somebody, like some celebrities who are getting pregnant in their 40s, or in their late 40s also. So the important thing is, every individual is different, their fertility is different. The rate of decline of fertility also differ from person to person, even in geographical areas. From It varies with different races. Caucasians, if you see,
Right.
Americans and Europeans, they have a higher fertility at a particular age compared to the same fertility in the same age group in Indian women. So we
Mm-hmm,
have to
mm-hmm.
see that. And if we are getting married late, or if you are planning for, then there are certain tests, they should get those tests done, see an infertility specialist, and never believe on the reference range which is given by the lab. Normally what we do when we want to get an hemoglobin check, we just go to a close by lab, get a hemoglobin check, and if it is showing in the range, if it is, your hemoglobin is 11.5 and it is showing the normal range is between 10 to 12, then you are happy that it is within the range. But these tests are very very specific. Don't go with the range which is given on the lab lab chart. They will give a range of between this to this is normal and you'll be happy, although it is in the lower range. It is lower side of the normal, and you should actually be trying actively for pregnancy. That you shouldn't get reassured, okay, but it is falling within the range and it is saying that it is normal. Important thing is get a test done and then meet an infertility specialist. Okay, they will be the right person to guide you, whether you should be waiting for a year or so, whether you should be waiting for another 2 years, 3 years. There are predictive models based on those tests where you can actually decide whether you should be actively pursuing the pregnancy, or you can delay. And if you want to delay, then how long? 1 year, 2 year, 3 years. So these advances have come in a big way, and I think the current generation, the youngsters, should really really adopt these, should go for these tests when they plan for pregnancy.
Absolutely. I am so glad to have you on board with us today because I am 34 and I have a lot of friends who are in this age only, and either they are just getting married or maybe they might get married in next 2 3 years. So it is a common topic between us that, obviously we do talk about it that okay, so and so is
Mhm.
happening and we don't know how to go on about it. So I'm so
Mhm.
glad that we touched this question and thank you for answering it. I'm sure it is going to help a lot of audience and people like me, people like my friends. So, moving on to the next question, what are some myths that you would like to break on this episode, on this podcast?
Shruti, this is another very good question. That what are the myths? There are so many myths associated with IVF, and we come across these kinds of myths every day when patients come and tell their stories, and they tell us, okay, the most important myth that I have seen with IVF is the age. In every patient's mind when they are suffering through infertility, the thing that goes through is like IVF is for people who are, who have already, in their 40s or in their late 30s. They think that they are too young. A woman who is below 30 or 25, if you talk about IVF in them, they are like, oh my god, I'm just 20, I'm 25, I'm just 28, I'm still young, why should I think about IVF? So important thing is age is definitely one of the most important predictor of success in any form of treatment, whether you are trying for a natural conception, whether you are trying for any other intrauterine insemination or IVF. Age is the most important factor of predictor of success. So if a patient is suffering from infertility, and the thing is they keep on trying multiple cycles through medications, and if they are not able to achieve success, then they move on to some other doctor, then they move on to some other doctor. They try all forms sorts of treatment, and when after 5 6 7 years of unsuccessful trial, when they feel now is the right age, then they move on to IVF, because at that time they feel that they are not in that age group where they should be opting for IVF. So important thing is the correct counseling is very important here. Second is proper investigation. You may be a candidate for IVF even in your 20s, even if you're 25, if your reports are showing that certain parameters have gone down drastically. The criteria for IVF, there are certain criteria which we decide, and it is not dependent on age. The important thing is once the patients are investigated completely, a proper counseling is required. A patient may be allowed to go through conservative methods for a certain period of time, but then they have to mark a stop, after which they need to move ahead. Otherwise, even with the IVF, if they come late to us, the success rate decreases drastically. So even if they, IVF also is not a 100% success rate procedure. So if a patient comes to us in their early stages of, problem, then we are able to help them better, we are able to give them a better success rate, rather than when they come where all their, options are exhausted and their reserves are exhausted. That actually, put them in the poor prognosis cases, and if with such patients, achieving success becomes a very, very difficult task. So the important thing is, you should the patient should understand that age has nothing to do with the IVF. Proper counseling is very important. If the counseling is good and we see that the patient fits in the criteria of a conservative, we go for a conservative management. But if we see if the patient is the candidate for IVF, then immediate IVF produce better success rate. So this is one of the thing that I see. And there are other, patients feel, if they are undergoing IVF, then they have to, be on a complete bed rest. They feel that if we have put an embryo, it's like a small ball. If they stand, or if they walk fast, or if they run, it is going to fall off. So this is one of the greatest thing. They feel whether we'll be able to continue our day to day activities. They ask whether meri mommy, chachi, and all, do I need to call them to take care of household chores and all those. So that these things, it's very important to understand. IVF is almost like a natural pregnancy only. There are no major, restrictions which are advised to the patient. They can continue with their normal day to day life activities. There is no bed rest advice to the patient. We in fact tell them to continue with their daily activities. They have to walk, they have to do 20 minutes walk after each meal. When they take food, they have to walk around, because they are on hormonal medications. And these hormonal medications, they tend to make your blood little thick. So it is advisable that they move around, so that the blood flow is maintained to the uterus, to the, their legs and everything. So the side effects of medications are much less if you are active, compared to if you are on complete bed rest. So this is another myth which is very commonly seen in IVF patients. And some other things are like, increased risk of cancer, the side effects with the medication. They feel if they take so much of hormones, they are going to land up with cancer. But the important thing here to understand is that pregnancy is the most important factor which protects you from any kind of cancer. Any kind of cancer, a female who has had a pregnancy in her lifetime is protected from ovarian cancer, breast cancer, endometrial cancer. The mere fact that you are suffering from infertility or not able to conceive puts you in a high risk group for cancers, rather than, the medications that we give to make a patient pregnant are actually pushing her towards in a safer zone. The pregnancy is going to put her in a safe zone, rather than, being in an infertile status. So the medication, whatever hormones that we give, the effects, side effects are transient. They are not long lasting, and they persist for that particular time, and then they subside. So there are millions of patients who have delivered by IVF, and the studies have shown that the medications usually don't increase the risk of cancer. So these are some of the things that we see in our day to day routine practice.
Thank you, Dr. Nupur, for breaking these myths, because I think, yes, these are some very common myths that people carry around with them. And because obviously they are, first of all, very scared of this. So that's why they don't even go for consultation. Until the time they don't go, they won't get to know these things. So I would like to show my gratitude to you for sharing these myths and breaking them. So, as we have already talked about the treatments that you offer, but here I would like to ask you, are there any particular treatments that a couple can opt for, something that you did not mention in the previous point?
The thing here is, if a patient wants to go for like a treatment procedure, first thing, it is not that IVF is the first option. We move according to an algorithm we first offer conservative treatment. If the patient doesn't conceive through them, then we move on to a higher step. And for some patients, IVF is the first choice of treatment. There are patients who opt for IVF other than infertility cases. Like there are patients who suffer from some genetic problem. They have history of hemophilia or thalassemia, or some mental problem in their genetic history of some lethal disease in the family, and they don't want it to be transmitted to their child. So these are also the couples for whom we do IVF, because IVF offers an advantage where before transferring the embryos, you can screen the embryos for any genetic disease. We call it pre-implantation genetic testing. So we screen the embryos, we screen the couple, the husband and wife, for the genetic problem, that genetic mutation, that specific gene. Another reason for patients to undergo IVF is history of any genetic problem in the family.
Right. Before moving towards the end of this conversation, I just have one more question for you. Could you tell the process in maybe a simple layman language for people to understand what they might be looking at if they intend to go for IVF?
So IVF process is it stimulate it is very similar to the natural process which takes place in your body. The thing here is to that natural process is actually enhanced with medications. So the process starts from the second day of a woman's period, and from that second day we give medications to the patient depending on what type of IVF they will be opting on. There are different types of IVF based on what the patient's requirement is, what the actual cause of problem in the patient is. So from starting from the second day, there are certain set of medications which are given to the patient, and they can be in form of tablets, they can be in form of injections. So these medications usually on an average go for approximately 10 to 12 days. If we take 12 days, so approximately 12 days the patient has to take the medications. The medications or the injections, that they don't need to come to the clinic daily for them. We give those medications, they can take them home, and they can, if there are injections, they can keep them in the refrigerator, and those are all self injections, very easy to take, pen form, and they just have to rotate the dial. The needle is very very small, like an insulin syringe, and the patient usually self inject medication to themselves. They are taught in every possible way, and every form of support and assistance is given to them in form of telephonic consultation, everything. We are 24 hours in touch with our patients who are undergoing IVF. So if they face any form of difficulty, even if they call at 10 in the even if they call in the midnight 12 or 2 a.m., we usually pick up the call and assist them with whatever difficulties they have. So it is like a continuous medication for, and then after certain period of time, like after 10 days, we'll give them a call, or they will come back to us for a review. We do the scan for them. The scan will show how they have responded to the medication. We need to assess the response. Sometimes we call them after 4 days, sometimes we call them after 7 days, sometimes we call them after 10 days, based on what treatment they are basically on. So if they are on injections, we call them after 4 days, then we assess the response. We change the dose of the medication, or we continue the same dose. And then based on the response, we give them an approximate date, that this date is going to be the day when we take out your eggs. So at approximately 14th day, the ovulation, the egg extraction date is usually confirmed to the patient. And they come, if they are undergoing egg pickup, they are advised to come in the clinic at particular time. And then the eggs are retrieved from the body under anesthesia. So it is not a painful procedure. The patient doesn't comes to know what is happening, because it will be like a mild anesthesia. The patient will have no sense of what is going on. Once they get consciousness, they will be informed about the number of eggs which are retrieved, and the same day, the eggs and sperms are fertilized and the baby is formed in the lab. And then after that, the patient is discharged with certain medications, and then they are asked to come back again after 3 days or 5 days. And then we tell them about the embryo status. We show them their embryos. Okay, these are the embryos. What kind of embryos have been formed, how many embryos have been formed, how many eggs were retrieved, and how many fertilized, how many embryos were formed, and how many embryos will be transferring back inside their uterus. And the remaining embryos, we will be freezing them for future use. If we get six embryos, we'll be transferring two to three. The remaining will freeze. If they want to conceive again after first child, then those embryos can remain frozen for another 5 years. So they can even come back to us for second child with those frozen embryos. So it doesn't impact the quality of the embryos freezing and all that. And once the embryo transfer is done, after that we call them after another 10 days. So approximately a 28-day cycle, if we consider, the 28th day we will get the result, whether the patient has conceived or not.
Thank you so much, Dr. Nupur Garg, for explaining everything in such detailing. And as you just mentioned towards the end, that you can even freeze the embryo and go for the second child with the same embryo. So, yeah, I think most of the people don't know about these things. So, thank you for sharing these. Lastly, to end the session, I would just like for you to mention how can people get in touch with you, how can they visit you, or yeah, basically initiate that first step towards IVF.
Shruti, it's very easy. We can always, patients who are in problem, they can always contact us through website. We have a website, www.sciivf.com. Our everywhere our numbers have been written. Two centers are there belonging to SCI. One is in SCI IVF sector 63 Noida, and another one, the center is in Greater Kailash, GK1, the S21 GK1, SCI IVF center. So these are some of the ways you can always connect to us. We are also, we give telephonic consultation to patients who are sitting in different cities, even in different countries. We are giving consultations telephonically if they have any problems or any doubts. And many of our patients visit us after getting all the investigations done, so that much of the time is saved. So yeah, these are some of the ways they can connect back to us.
All right, Dr. Garg, thank you so much for taking out time for this conversation and sharing all that information with our audience. I am sure it is going to help a lot of people to take these decisions and be a little fearless and, yeah, get in touch with you to start or initiate the process of IVF for themselves. Thank you. Thank you for taking out
Thank
time
you so much,
and
Shruti. Thank you for inviting me to the podcast. Thank you so much. It was a pleasure. It was a pleasure. Thank you so much.
have a great day. Bye bye.
Bye.
So, guys, as you just saw and heard the conversation that I just had with Dr. Nupur Garg, and for me also it was an eye opener because there were a lot of things that even I did not know. So, I would suggest each and every one of you to um, hear to what just happened, here to what just Dr. Nupur Garg said. And if you have any questions or anything, please feel free to get in touch with them. Um, and I wish you luck, wish you a beautiful life. I'll see you soon with another episode and another way of life, another motivation to keep going on. Thank you. Shruti Outloud welcomes all stories. It can be a brand, it can be an organization, or it can be a person. The only thing common would be passion for life. Please subscribe to this podcast on Spotify, Google Podcast, Apple Podcast, Amazon Music, Ghana Podcast, and every other platform where you can hear this. Please leave a review as that helps my podcast to grow. Thank you once again. See you for the next episode. Bye.